Welcome back. So one of the few facilities here in Colorado that helps kids during a mental health crisis is now under fire, and critics are saying there are dangerous conditions there.
The Denver nonprofit Disability Law Colorado spent 3 years documenting conditions. This was at the Southern Peaks Regional Treatment Center in Canyon City. Denver 7's Allie Jenner-John is joining us now. Allie, that report is now public with the nonprofit telling you that they feel like the kids have been failed.
Yeah, they said some pretty strong things there, but they're saying that because there's only a handful of options for kids who need psychiatric treatment centers. So Emily Harvey, the co-legal director at Disability Law, says a routine visit to Southern Peaks Regional Treatment Center found a list of concerns, and she knew if they weren't fixed, kids and families from the Denver metro and really across the state would see the impact. So here's a list of the report's key findings after 3 years of in-person visits and interviews with nearly 50 patients. Excessive restraints, an average of 75 times a month as of May of this year. Frequent staff turnover causing a lack of consistent mental health care. Poor conditions like metal beds and undercooked food. And the lapsing of the Youth Advisory Council in clubs like dancing, running, and choir. Now that matches up with the concerns we heard from Katie Gallogas and her daughter, Jayla Hunt, who spent 4.5 months at the facility.
I would get sometimes multiple calls a day saying Jayla was in a physical restraint for 40 minutes. I just really, and so it was difficult to keep getting these calls, knowing she's in a different city, knowing she's supposed to be getting treatment, but she's just being restrained.
Inside the facility, Disability Law did acknowledge some positive steps like new leadership at the center and improvements in therapeutic services. But the report also listed more solutions like training staff to provide more trauma-informed care. Now, we did reach out to the center, the nonprofit that runs them, as well as the State Department of Human Services, which licenses them. None of them have yet to get back to me. But a lot of things going on there, and I know a lot to follow up as we go forward.
Yeah, and I think it's interesting. I've been following some of these issues for several years now, back from when an emergency was declared for a mental health emergency for kids with Children's Hospital. And one of the things that you were hearing from doctors was having to send kids out of state because there just weren't enough beds. And now you're talking about one of the few facilities that we do have coming under such heavy criticism.
Well, and I will just add to that, the family I spoke to, they were looking at places in Kansas because they felt like maybe the services here, they said were, quote, subpar, but ended up that Medicaid was able to help them out here. So it worked out, but they had few options to choose from.
All right. Thanks so much for joining us this morning.